Welcome back to Ellie Scrubs In. This is part 3 of our Surgical Instrument Guide series, where we walk through core tools you'll encounter in the general surgery operating room. Today, we're expanding your knowledge with 10 more surgical tools, each with a critical role in surgical exposure, dissection, hemostasis, or wound closure. Let's scrub in. Lister bandage scissors. Lister bandage scissors are a deceptively simple yet essential tool in surgical and post-surgical care. Their defining feature is the blunt, flattened lower blade, which allows the scissor to slide safely between skin and material. This design was intentionally created to minimize the risk of cutting the patient while removing dressings, tapes, or compression wraps. In the OR, these scissors are not typically used in the sterile field, but you'll find them in the hands of circulating nurses, in recovery rooms, and on inpatient floors. They're most commonly used postoperatively to remove outer dressings, cut through surgical tapes, or even trim cast padding or wraps. Because they're not sharp-tipped, they allow providers to work quickly without fear of accidental skin nicks. Occasionally, you may see them used in minor emergency department procedures or for trimming non-sterile suture tags after superficial closures. But in most surgical cases, they remain an external tool. They're also commonly used during surgical gowning, for cutting away sleeves, bandage ties, or stuck adhesive. Pearl. The Lister scissors' lower blade acts as a safety guard, perfect when working near hidden skin edges, drains, or surgical sites. Always angle the blunt tip downward when cutting to avoid injury. Pitfall. These scissors are not designed to cut tissue. Using them in the sterile field or attempting to trim sutures or dissect fascia will quickly dull the blades and compromise your technique. Keep them where they belong, with dressing materials, not in the operative tray. Iris scissors. Iris scissors are precision instruments, small, fine-tipped scissors originally used for ophthalmic surgery. In modern general surgery, you'll find them used for delicate dissection and fine trimming, especially in plastic surgery, ENT, or layered closures where cosmetic precision matters. Available in both curved and straight variants, these scissors offer unmatched control when cutting through fine tissue or trimming suture tails in tight spaces. Their short, sharp blades let you get close without compromising nearby structures. You'll often see them used in skin grafting, hand procedures, or subcuticular closures. Even when not scrubbed in, residents often carry a pair in their pockets for quick suture or dressing adjustments. Pearl. Use curved iris scissors for contouring around natural curves like eyelids or hands. Pitfall. Avoid cutting fascia or dense tissue. These scissors are delicate and easily misaligned or dulled. Senn Retractor. The Senn Retractor is a double-ended, handheld retractor widely used in minor procedures and soft tissue cases. One end has a smooth, L-shaped blade ideal for blunt retraction, while the other features small, rake-like prongs that gently hook tissue. This tool is invaluable in skin and subcutaneous dissections. Think lipoma excisions, small hernia repairs, or orthopedic incisions. Because of its small size and versatility, it's often the first retractor handed to a junior resident. Senn retractors give the surgeon fine control and are especially useful when you're working solo or in a tight space where self-retaining retractors would be too aggressive. Pearl. Use the smooth end first. If more traction is needed, switch to the rake end gradually. Pitfall. Don't dig in with the raked end. It's easy to cause small tears in friable tissue or lacerate vessels if overused. Russian forceps. Russian forceps are large, rounded, and deeply serrated pickups that provide strong yet relatively atraumatic grip on bulky tissue. The broad, spoon-like tip is ideal for grasping thick structures, uterine fundus, fascia, or even large tumors, without crushing or slipping. You'll see them used commonly in OB/GYN, general surgery, and oncologic resections where the surgeon needs to lift or manipulate dense structures. They're also helpful during abdominal wall closures where grip on fascia is critical. Because of their strong grip and wide tip, Russian forceps can reduce tissue trauma in areas where standard toothed pickups might shred delicate surfaces. Pearl, best for thick, slippery tissue, especially helpful in retracted cavities or during mass resections. Pitfall, avoid using them on bowel, vessels, or nerves. They can still exert enough pressure to cause damage if misused. Penrose Drain. The Penrose Drain is a soft, flexible, passive drainage tube made of rubber or silicone. It works via capillary action and gravity, allowing small amounts of fluid, serous fluid, blood, or pus, to escape a wound cavity. It's often placed in clean contaminated procedures like thyroidectomy, parotid surgery, or perianal procedures to prevent fluid accumulation and promote drainage without suction. Surgeons may loosely suture it to the skin to prevent migration. Unlike active drains, Penrose drains don't have a reservoir. The fluid drains into a dressing, which must be changed frequently. This simplicity can reduce complications related to suction, but requires diligent wound monitoring. Pearl, best used when gentle drainage is needed, especially in the neck or perineum where suction may cause problems. Pitfall, always secure with a suture. An unsecured Penrose can migrate into the wound and become a retained foreign object. Doyen intestinal clamp. The Doyen clamp is a non-crushing bowel clamp used to temporarily occlude intestine during resections or anastomoses. It's long and straight with smooth, gently ridged jaws and spring-loaded arms that apply just enough tension to hold tissue without damaging it. Surgeons place these clamps proximal and distal to the segment of bowel being removed. Their atraumatic grip preserves the blood supply and reduces risk of ischemia or serosal injury during the procedure. They come in multiple sizes and are often used in pairs. In a right hemicolectomy, for instance, you'll often see two Doyens isolating the cecum while staplers or scissors are used between them. Pearl. Doyens are ideal for preserving bowel viability during resections. They provide gentle occlusion without trauma. Pitfall. Don't confuse them with crushing clamps. Improper use could result in devascularized bowel and failed anastomosis. Foerster sponge forceps. Foerster sponge forceps are ring-handled, long instruments with oval jaws designed to hold gauze or sponges. They're ideal for prepping the skin with antiseptic, gently mopping up fluid during surgery, or for delivering packing material. Unlike a sponge stick where gauze is added manually, Foersters are pre-shaped to securely hold a folded 4x4. They're often used during gynecologic surgery or cavity exploration, and sometimes during vaginal deliveries to apply pressure or clean the field. They also serve as gentle blunt dissectors when exploring the pelvis or other sensitive areas, especially in surgeries with high vascularity or unclear anatomy. Pearl. Foersters are your best friend during skin prep or blunt cavity exploration. Pitfall. Don't substitute them for pickups or clamps. They're not designed for gripping tissue or placing sutures. Lahey traction forceps. Lahey forceps are small, sharp-toothed forceps used to grasp and hold fibrous or glandular tissue. Their three-pronged tips make them ideal for surgeries involving the thyroid, parotid gland, or lymph nodes. They excel at providing traction, helping elevate a lobe of the thyroid or stabilize tissue for dissection. You'll often see them used in head and neck surgery or endocrine procedures to lift and expose structures, like the recurrent laryngeal nerve. Despite their small size, they exert a firm grip and allow for controlled directional pull, minimizing the need for larger retractors in delicate fields. Pearl. Use Lahey forceps for thyroid lobectomy or node dissection, perfect for gentle, directional traction. Pitfall. They're not general-purpose pickups. The sharp points can cause trauma if used on thin skin or soft tissue. Gelpi Retractor. The Gelpi Retractor is a self-retaining retractor with two curved arms that open outward to maintain tension on wound edges. Each arm ends in a sharp point that anchors into tissue. Once deployed and locked into place, it provides hands-free exposure, ideal for perineal, spine, or orthopedic surgeries. The Gelpi shines in deep, narrow fields where other retractors fall short. It's especially useful when exposure is needed in muscular planes where visibility is otherwise poor. Always pad or monitor the tips during long cases. Tissue can suffer from pressure necrosis or nerve injury if left too long. Pearl. Ideal for solo or deep exposure. Gives excellent visualization without needing an assistant. Pitfall. Sharp points can injure muscle or nerves. Never yank or place without counter traction. Joseph Skin Hook. The Joseph Skin Hook is a precision retractor used for elevating skin during flap dissections or closure. Its fine, curved tip allows the surgeon to lift skin edges without applying wide pressure, reducing trauma in delicate procedures. You'll see it frequently in plastic surgery, ENT, vascular procedures, and even neurosurgery. It's typically held between the fingers like a pencil and provides targeted one-point retraction. It's incredibly effective when used in pairs, one on each side of the wound, to gently elevate tissue without tearing. But be careful. A sudden jerk or too much tension can cause the tip to cut through skin. Pearl. For fine flap elevation, nothing beats the control of a skin hook. Pitfall. Don't use on muscle or thick fascia. It's too delicate and can break or bend under stress. That's a wrap on Part 3 of the Surgical Instrument Guide. We've now reviewed 30 essential general surgery tools across 3 episodes, from scissors and forceps to retractors and drains. Keep this knowledge close. It'll serve you well in the OR. Be sure to subscribe and check out Part 4, where we go even deeper into surgical instrumentation. Thanks for watching Ellie Scrubs In. See you next time.